Today, we're diving into a fascinating study about preventing falls in hospitals through
Yeah,
structured nurse-patient conversations. Let's get started.
I'm excited to hear about this. So, what's the main takeaway from the study?
Well, the research explored how involving patients directly can lead
Right.
to better outcomes in preventing falls.
So, they focused on patient engagement?
Exactly. They used a structured conversation between nurses and patients, supported by an
hmm
information leaflet.
Oh, so not just handing out pamphlets, but actually talking through it with patients?
Yes, precisely. It's more interactive.
Yeah,
Patients can discuss their concerns and understand their fall risks better.
that sounds effective. How did the patients respond?
They reported high satisfaction levels and felt more
Great.
involved in preventing falls.
That's fantastic. And what about the nurses?
Um, the nurses found it beneficial too, although some mentioned challenges like time constraints.
Right. Time is always a hurdle in busy wards.
Exactly. They struggled to fit the conversations into their routines,
hmm
especially with heavy workloads.
Were there any other barriers?
Yes, environmental factors like noise and a hectic atmosphere made it tough.
Yeah,
It was hard to have meaningful talks in that setting.
I can imagine. But the overall response was positive?
Definitely. Nurses saw the value in the intervention and wanted to
Right.
continue using it.
So, did the study show a reduction in fall rates?
Well, during the study period, the fall rate didn't decrease significantly,
Oh,
but the focus was more on experiences and feasibility.
I see. So it's more about the potential for future improvements?
Exactly. With some adjustments, the
Yeah.
intervention could have a greater impact.
It's like setting the foundation for better practices.
Yes, and it emphasizes the importance of patient involvement.
Absolutely. So what's the next step for implementing this intervention?
They suggest adapting the materials and supporting nurses more to make it
Right.
sustainable in daily practice.
That makes sense. Maybe involve other staff members too?
Yes, perhaps include healthcare assistants or family members. It's about
Yeah.
a team approach.
Well, it's encouraging to see studies focusing on patient engagement.
Definitely. It's crucial for improving patient safety.
hmm Thanks for sharing this. It's been enlightening.
My pleasure. Always great to discuss such important topics.
Agreed.